Hello, my name is Lindsay Sethman, and I'm here at American Career College Hospital with the Diabetes Mellitus Awareness Week. I'm here with Dr. Sovan Chun. She's going to be talking to us today about diabetes mellitus. So, Dr. Sovan, what exactly is diabetes and how is it caused?
Okay. Well, diabetes is a relatively common metabolic disorder that affects the way the body uses food, energy, and growth. Now, the food we consume is converted into glucose, also known as simple sugars, that enters the bloodstream as a source of fuel. Now, insulin is produced by the pancreas, and it helps regulate the level of glucose, as well as using the glucose productively. Now, people with diabetes experience insulin failure, and it results in elevated blood sugar. This causes both the short-term symptoms of diabetes, also known as, some of the few symptoms are excessive thirst, and it also destroys the body's organs. Now, the way in which insulin fails determines how a diabetic is classified.
Oh, so there's different classifications.
Yes,
Okay,
ma'am.
how are they classified?
Okay, well, there's type 1 diabetes, and then there's type 2 and gestational. Type 1 diabetes is common in children that are under the age of 20 years old. It is when the body's immune system gets confused and destroys other cells. The pancreas then stops making insulin altogether. And now those that do have type 1 diabetes, they take insulin daily.
For life?
For life, yes. Then there's type 2 diabetes. That's common. It's by far the most common. It's due to insulin resistance, which is a condition related to excessive body fat. Type 2 diabetes usually develops in obesity, and this condition occurs when a normal amount of insulin no longer suffices, causing the increase of blood sugar to rise. The pancreas then responds by making extra insulin to lower down the sugar. Diabetes results when the pancreas can't keep up. Other times, type 2 diabetes just stop producing enough insulin. It's common in those that are obese, those that weigh over about 20 pounds or more, those that are over 40 years old, and those that people that do have type 2 diabetes, it's because they have a family history, and also ethnicity plays an important role.
I see.
And then there's gestational diabetes that's common during pregnancy. Women that women are most commonly to have those gestational diabetes. It's when the pregnant hormones reduces the receptiveness to insulin. Women that do have gestational diabetes, they have personal history of it. It's common for women, yes.
Okay, and how would you diagnose diabetes?
Diabetes is currently incurable, but there are treatments for diabetic patients to live a longer, healthier life. It can be detected by carrying out a urine test, which finds out whether excess glucose is present. This is also normally backed up by a blood test, which measures blood glucose levels and can confirm if the cause of your symptoms is diabetes.
Okay. Well, thank you very much, Dr. Sovan. We really appreciate you being here.
Thank you.
Now we're going to have some other interviews today. We have Nurse Casey and Nurse Betty coming
And now
on.
I'm
here with Nurse Betty and Nurse Casey. Nurse Casey,
Yes.
what are the treatments? Like, how would you treat diabetes as a nurse?
Well, as a treatment for hyperglycemia, which is high blood sugar, we take their check, and then if the number is really high, we give them insulin, which insulin is produced in the pancreas, and which stimulates the flow of sugar, which is glucose, from the blood into the cells of the body. And glucose provides the cells with the energy in order to function. There's two main groups of insulins. There's human insulin and there's analog insulin, which is made of DNA technology. There's 4 different categories. There's very rapid, there's regular, there's intermediate, and there's long-acting insulins.
Okay. And what are the differences between these different types of insulins?
Well, very rapid insulin is Humalog or Novolog. And they begin to work within 10 minutes, and they stay in the body from about 3 hours, 3 to 4 hours. And then regular insulins is just regular, and it's a little bit different. It's a rapid acting, but it also works just the same. It begins to work within 30 minutes after injection.
So the difference is the timing?
Yes, and it stays within the body about 6 to 10 hours.
Oh, okay. That makes sense. Okay. And what are the acute and chronic complications if left untreated?
Acute complications of diabetes are severe and can lead to coma. They are related to blood glucose levels and include diabetic ketoacidosis, which is more common in type 1, and this is caused by the breakdown of fatty acids into ketones, which there is not enough glucose stored in the body for energy. And chronic complications involve blood vessels, tissues, and organs. Consistently high blood sugars, sugar levels, can cause a hardening and thickening of blood vessels, which can lead to many other complications.
Okay. So Nurse Betty, what are the signs and symptoms of diabetes mellitus?
So signs and symptoms of diabetes are very common, and people usually go undiagnosed because they seem so harmless. You would usually have frequent urination, excessive thirst, you'd be intensely hungry. You'd have weight gain as a result of the hunger. Unusual weight loss is more common in type 1 diabetes since the body isn't making insulin. It's going to seek out another energy source, breaking down muscle tissue and fat. So it's more noticeable in type 1. You'd have increased fatigue. You'd be irritable due to your lack of energy. Your cuts and bruises wouldn't heal properly because of your body's ability to heal.
Okay, well thank you very much. Now we are going to go on to Vasani, who has an actual patient she's going to interview for us.
Thank you, Lindsay. Now I have Mr. Chris Chung with me, who is a diabetic patient himself. So, Mr. Chung, how does diabetes affect your life?
Well, to be honest, when I was diagnosed with diabetes, it hurt me financially and emotionally. Because, buying the insulin shots and the oral medication, it's expensive. And on top of that, I had an addiction.
If you don't mind me asking, what kind of addiction do you have, Mr. Chung?
You know what? I can show you right now what I had. I was addicted to these.
Hose?
Yes.
Oh my God. So...
I had to give up this. You don't understand how much I'm feeling right now. Every time I see this.
I see that it affects your diet a lot. So, what did you do to change it?
Well, the doctor told me if I don't stop this, I could die.
So...
I have a video of me right now.
Okay.
Oh, so good.
Hello, Chris Chung. I have your lab results with me, and it shows that you have diabetes. That means no more ho-hos.
Oh, sorry. No, my ho-hos.
So wow, that clearly is really something, Mr. Chung.
Yeah, I know.
So what do you do different now?
Well, ever since then I laid off the ho-hos, because my doctor told me if I don't do it, there's a chance I could die. I don't want to risk that. So I talked with my doctor and my dietitian. They told me to, lay down on the carbs, don't drink soda, just water. And every time I buy food, just look at the nutrition label. So that's what I do now. I eat a lot of fruits and vegetables, and down the hose.
What about your daily activity? What have you done to slow down the complication of this disease?
You know, I just work out every single day. You know, ever since that video we just saw of me, you know, I lost at least like 150 pounds.
Yeah, I could see that.
I know, thank you. You know, I look good now.
Yeah.
And other than that, when I run errands, I park, you know, at the end of the mall strip, so you know I can walk. And I check my blood sugar at least twice a day, you know, to maintain my, to control my blood sugar level. And if it gets too high, that's when I use my insulin shots.
Well, I'm happy for you, Mr. Sean. So keep up the good work, okay? Thank you for your time. So, and now back to you, Lindsay.
Wow, Vasani, what a remarkable young man. And that's all for today at Diabetes Awareness Week. We thank you for tuning in and have a nice life.